Hi everyone, my name is Lauren Curtis and today I'm going to talk to you about the Zika virus. So some background information regarding it, mainly like what is Zika virus? So Zika virus is spread through people primarily through the bite of an infected Aedes mosquito, and it's the same mosquito that carries yellow fever. And so once infected, many individuals actually won't even have symptoms or mild symptoms, so it could be very hard to detect. And a severity of this virus is it could affect women and their fetus and during pregnancy. And we'll talk about that a little bit later. So exactly how it it started and it was first discovered in Uganda in a monkey in the Zika forest in 1947. And then it started a couple years later. The first human case was detected around the Asia, Pacific Islands, and Africa area. And then it started to spread over to the Americas. And then in 2016, the CDC activated its Emergency Operations Center to the response of the outbreaks that they were seeing. And then a couple weeks later, the World Health Organization declared public health emergency because of the microcephaly and just the birth defects, and so it started to spread around the world and eventually to the United States as well. So like I said earlier, it's mainly spread through mosquito bites, and these mosquitoes are typically breed in domestic water holding containers. Also, pregnant women can infect their fetus if they were infected. If you have sex with a partner who has been into an area affected by Zika, that's a risk. And even exposure to blood or semen or urine and those type of fluids can also be a way that Zika is spread. Symptoms wise, many won't even have symptoms, like I said earlier, but some common symptoms shown here in the picture are fever, rash, headache, joint pain, red eyes, and muscle pain. And it can be kind of hard to determine if a person is infected due to many won't have symptoms. So why is it risky? Ultimately, Zika infection during pregnancy can cause microcephaly. So microcephaly is a birth defect in which a baby's head, as you can see in the photo, is a lot smaller than expected and can cause a lot of problems ranging from hearing loss, brain development, intellectual disability. And so women can get really infected at any trimester, and there's been a lot more reports of the Guillain-Barré syndrome, which is an uncommon sickness, which has also been in areas affected by Zika. So that can cause paralysis. So this is a big deal with women who are pregnant being infected. Treatment, there is no specific medicine or vaccine for the Zika virus. So people really target treating their symptoms with drinking lots of water and talking to their healthcare provider to see how to fight this virus and trying to treat it with no specific medicine or vaccine yet found. Also, a way is prevention to try to not get the Zika virus. So avoid mosquito bites first and foremost, and avoid traveling to affected areas. So if you are going to an affected area, CDC recommends using insect repellent containing DEET, wearing light colored clothes, and covering as much as the body as possible, being in closed doors and windows, and sleeping under mosquito nets, and trying to not be bit by a mosquito. So looking into the public health sphere and healthcare providers, CDC really created guidelines for the healthcare providers to follow up with pregnant women during the outbreak of Zika. So healthcare providers should ask all pregnant women, no matter what, their recent travel. So if a woman has any two symptoms of Zika or has been to an area with a history of Zika, they should be tested and looked at further, just as a precaution, and also have ultrasound exams to consider and monitor the fetal growth and anatomy of the fetus. So this is a public policy and a public awareness for healthcare providers throughout the United States to just truly look into pregnant women and see where they have gone and if they're at risk for this virus. So as a world stance, the World Health Organization responded as well to the Zika virus outbreak, and they called it a Zika strategic response framework. So they had a strategic plan and policy that outlined four main objectives. First, detecting and developing surveillance systems for Zika virus. Two, prevention, to have mosquito control, risk communication, and community engagement 3, care and support, to strengthen the social systems to provide services for individuals and communities that are affected or could be. And research, to fast track this research field into control tools and just have these lot of tests and vaccines in order to fight this virus. Also, it is in the United States, there's a Zika Response Appropriations Act in 2016. So it was a summary that gave around $620 million for the fiscal year to strengthen the public health activities. So that would allow for CDC to prevent and prepare and ultimately respond to the Zika virus and have the means to do it with partnering with public health and social services emergency funds to develop the necessary means they need to fight this with mosquito control, preclinical and clinical development of vaccines, and be able to fight their virus and have the means and the money to fund fighting it. So if we look at the United States, in 2015-16, large outbreaks occurred in the Americas. So that resulted in Puerto Rico, U.S. Virgin Islands, and then, as you can see in the picture, Florida and Texas kind of got the most of the Zika virus. And so it started, however, in 2017 after a lot of the public health awareness and the policies started to decline. And now in 2018-19, no local mosquitoes borne virus transmission has been reported in the United States. They mainly are through travel. And so that means that there's no local mosquitoes that have been born and raised from the United States. They only come from places that people have traveled to with the Zika being affected. Now, tying it back to Oklahoma in the public health and public policy, the Acute Disease Service of Oklahoma State Department has received confirmation that Oklahoma's residents have acquired Zika during international travel to countries, so not locally again. And it's reported as an unusual disease or syndrome. And they have talked about an integrated pest management in that policy. So they wanted to reduce mosquito populations in Oklahoma, and it's usually developed by local mosquitoes, but they need to identify mosquito-filled places in the area. However, Oklahoma is lacking in funding and budgeting for this virus and for taking precautions in this virus. So they have these ideas and they have these policies that they want to implement, but they just need the funding to do so. So overall, with public policy with Zika virus, from a policy perspective, there's lots of unknowns in how to fight this, and they've done a lot that they could have as the United States and just as a world in general. So many developments are on the rise, just like one being the vaccine development. There's currently no vaccine for Zika. However, 45 candidate vaccines have entered research and they're now moving to clinical trials. So that means there's development in that policy. Second, provider preparedness. So there's a lot of providers, local public health officials, and community-based organizations. Part of this strategy is to try to reach as many different, have policies that reach healthcare providers and the government to try to fight this virus. Thirdly is control mosquitoes. So by draining standing water to prevent mosquitoes from breeding, interrupting contact with humans, and even Oklahoma's trying to fight that as well, is to try to figure out where mosquitoes are breeding and trying to reduce that as well. So that's another policy. And then public health officials, like I said earlier, to educate people who have the virus and to protect themselves and to be able to protect the community as a whole. So that's my presentation and these are my sources and I appreciate you listening.